Katie, thank you so much for finding me. I'm glad that you're here, and I really appreciate you allowing us to highlight what physical therapy for the pelvic floor is, kind of what the assessment looks like, and how it goes. So with that in mind, I've got two consents for you. One is just to allow me to do the exam, one being an internal exam, and you can at any point say, no thank you, that's not going to happen today, or sure, I want that information.
Okay.
But having an internal exam will allow me to really get a better understanding of what the pelvic floor function is like. Is it coordinated?
Okay.
Can you lift? Can you tighten? I'll do my evaluation, write up your findings, your plan of care, send it to your physician, and 99% of the time they agree to this, and I take off and do what I feel is best for the healing and strengthening or relaxation of your pelvic floor.
Okay.
So can I start out by kind of asking a little bit about your history, what brings you in, tell me a little bit about your gynecological and obstetrical history.
Okay. Yeah, so I had my daughter last December, so December 11th of 2017. First pregnancy. And I gained about 50 pounds, which I think compared to average is a little high. And I have never had back pain or anything before. My low back hurt during pregnancy, but I think obviously most people's do, and just gaining that amount of weight I think is just hard on your body. Prior to pregnancy, I taught classes actually at Lakeside Country Club. So I've always been
Exercise classes?
Yeah, exercise classes. So I've always been really consistent with exercise, lifting weights, and things like that.
Do you still do that kind of activity now?
I
for
do.
exercise?
Yeah.
Okay.
The one thing that I have not been able to do since having her is run. I just it's gotten better over this past year, but especially when 3 or 4 months after having her, when I first started trying to run occasionally, I'm not talking run a lot, I mean run half a mile, I have pain. The best way for me to describe it is just around I don't think it's my actual incision that hurts, but it's just around the area. And then in my groin, I guess. I don't know exactly how to describe it, but it's sharp pain from incision down. And even sometimes just if I step out of the car in a weird way, I'll have just a quick shooting pain through that area.
Again, through above the pubic bone and through the groin?
Yeah.
Has that decreased, did I hear you say?
It has decreased, since I first had her compared to now. I would say I can go out and run about a mile and be okay. I'll just be really sore and tight afterwards. I had a relatively normal pregnancy, and I was induced on my due date because they said that my baby was expected to be very large, and my doctor felt since I wasn't showing any signs of labor, she felt it would be my best chance to have the baby vaginally. And so they induced me, and I did end up, I dilated to a 10, I pushed for 3 hours, and then had to have an emergency C-section.
Due to?
So I just could not even come close to getting her past the pubic bone.
She just didn't progress down the birth canal.
Yeah.
Okay. Tell me a little bit about your bowels. How often are you having a bowel movement?
I would say, gosh, I feel like I should pay better attention to what my body's doing. Shockingly, I feel like that has been better since having a baby. So I would say at least every other day.
And prior to pregnancy and delivery, it would be less frequent?
Yeah, less frequent. I always have had issues just with digestion and things. I didn't eat dairy for a really long time because that would kind of mess up my system. And I mean, I would have times where if I was traveling and not eating on my regular diet, I would go a week or two without going to the bathroom.
So, yeah. Ideally, I'd like to see you having a bowel movement at least once a day.
Okay.
So, are you continent of your bladder? Any accidents with leaking?
No.
Any sense of urgency? I don't make it to the bathroom on time. I can't get the key in the back door fast enough. and take a look. I'd like to take a look kind of at your posture, how your hips and pelvis are moving.
Okay.
The pelvic floor is a hammock, if you will, 3 layers, a sling of muscles that line the bones of the pelvis.
Okay.
So the pelvis being the right and the left ilium,
Right.
connected at the front by the pubic bone and ligaments,
Okay.
and connected at the center in the back by the triangular sacrum. At the very tip of that is the coccyx. So the hammock of muscles lines that entire pelvic floor. That
Okay, so
lines-
all in this area.
So if your pelvis here and your pelvis here, they connect at the pubic bone at the front. The hammock of muscles is at the base.
Okay.
Like it runs horizontally in this direction.
Okay.
Okay. So here's your pelvis connected at the pubic bone, connected at the sacrum in the back. The hammock of muscles runs like this. Okay.
Okay.
And it
Now that you describe it like that, I'm like, oh, that's what's hurting when I'm running all those
Yeah.
muscles.
So the hammock of muscles' job is not only sexual, but to be sphincteric, meaning these are voluntary muscles, just like our biceps or our quadriceps. Our brain can tell them tighten and work, close. Tighten those sphincters of the urethra, the sphincter of the vagina, and the sphincter of the rectum. Okay, we should be able to tighten and hold back, not pass gas when we're in the elevator with strangers. You know, not leak urine until we get to McDonald's 20 minutes down the freeway, and also be able to lengthen those muscles, relax those muscles to allow exams to go on, tampons to be worn, penises, exam fingers, things need to come in and out, and they need to be able to lengthen and bear down and push babies. Lengthen and bear down and have a bowel movement. So these muscles that run horizontally, they need to be able to tighten and lift, hold, let go and hang out most of the day.
Yeah, I feel like I
And
should have
lengthen
had
and
this
relax.
conversation before trying to give birth, because then maybe my muscles would have been able to bear down and push the baby out.
So with this history that you mentioned of constipation, I'm curious if your lengthening and bearing down function is good and healthy, or if that function of constipation maybe have been a result of diet or stress or posture on the toilet. Any of those things could have been reasons for sluggish bowels or difficulty. Let me ask you one other question. Is intercourse comfortable?
You know, it is less comfortable now. Yeah, it is less comfortable. When I went to my first postpartum checkup, my doctor did tell me that to expect things to be very dry as long as I'm breastfeeding. And so I've always just chalked it up to that.
Are you still nursing?
I am, yeah.
Your baby is
A year.
Yeah,
Yes,
okay.
I am working on the weaning
Okay.
process. I only nurse her now in the morning and at night, just to like put her down at night and for a little extra nutrition in the morning. Mostly because if I don't nurse her, I'm uncomfortable.
Sure.
And so it won't be too much longer. I don't think that I'm nursing her because she just doesn't need the milk anymore. So anyway, I don't know if I've always just chalked up. I've always thought that the discomfort is because I'm nursing and
the
so things
estrogen.
are dry. Yeah.
Sure. So on a scale of 0 to 10, how uncomfortable is intercourse for you?
10 is the
10 is
most
miserable.
uncomfortable.
0 would be nothing.
I would say maybe like a 5 or 6.
Okay, that shouldn't be hurting.
It's most uncomfortable in the beginning and at the end. Like the in-between middle part is fine and I'm able to enjoy it. But especially at the end, it's weird, like once it's over and like he takes it out, it is very painful, like very uncomfortable.
How long does that last? Into the next morning, through the evening?
No, I would say maybe just like an hour, couple hours. It used to also be very painful, like afterwards, and then like I would go to the bathroom, like just to pee, and it would hurt like to pee afterwards.
Okay. So did you say that's getting better, or it's just still at about a 5 or 6?
Yeah, it's still about the same, as it's been ever since, postpartum.
Okay. That alone may make you feel okay with let's doing a pelvic floor exam.
Okay.
It's, again, always your call. And if
Okay.
we start and it's not something that you're comfortable with, you always have the opportunity to say, no thanks, let's stop. I'm not good with that. So, all right. So let's move into our exam, and I want to take a look and see kind of how your posture is, how you're bending and moving, how the hips and pelvis move. Generally, how is the strength of the pelvic floor in sort of a global term, and I'll look at your scar.
Okay.
I want to look at your big belly, diaphragmatic breathing, because diaphragmatic breathing, different than how we breathe all day long. We typically breathe more shallow, but diaphragmatic breathing is going to be in parallel to the pelvic floor. So the diaphragm is the breath muscle of breathing that runs horizontal underneath the rib cage, and it's the top of our pressure system. It's the top of the core. The pelvic floor is the bottom.
Okay.
So when we take nice, big, full abdominal diaphragmatic breaths, the ribs expand, the lungs fill, the diaphragm comes down with inhale, it pushes these organs south. Therefore, the pelvic floor has to move south to make way for oncoming organs. And as the pelvic floor moves south, the openings to the urethra, vagina, and the rectum get larger. So learning to diaphragmatically breathe is going to help you feel like, so the diameters, the tensions get less in the pelvic floor, the bladder can more fully compress and empty. The opening to the urethra and the vagina are larger, as well as the rectum. Things can come in and go out much easier with big full inhalation and a softened pelvic floor. Make sense?